A diagnosis of autism can have varying implications for children and families. It is important to remember this when considering how the diagnosis of autism will affect each child. People diagnosed with autism spectrum disorder may face similar challenges with sensory processing, social skills, and communication. Every child is unique. While in the past, autism was known by several different names such as Asperger's syndrome, pervasive developmental disorder, or PDD-NOS, those labels are no longer used. The current terminology used for a diagnosis is autism spectrum disorder and is rated by severity using a 1-2-3 scale. Autism spectrum disorder must be diagnosed by a qualified professional and is characterized by the following: persistent deficits in social communication and interaction, restricted repetitive patterns of behavior, interests, or activities. These symptoms must be present in early childhood, but may not be recognized until a child faces more demands on their social and communication skills. Before a child receives a diagnosis, it must be shown that the child's symptoms cause significant impairment in social, occupational, or other important areas of current functioning. It must also be shown that the symptoms are not better explained by another disorder. This indicates that the person with autism requires support. Children with this level of severity are often referred to as high functioning, but will have noticeable struggles with communication and social interactions when appropriate supports are not in place. Severity indicates that the person with autism requires substantial support. Children diagnosed with level 2 severity are sometimes referred to as moderately functioning or moderate. These children will have apparent deficits in verbal and nonverbal social communication skills and social impairments, even with supports in place. The most severe form of autism spectrum disorder, this indicates that the person with autism requires very substantial support. These children will have severe impairments with multiple areas requiring significant support in communication, managing anxiety, and coping skills. Regardless of the child's diagnosis, know that there are multiple supports and resources. Keep all diagnostic information, evaluation, and specialist notes in a safe place. To learn more about autism spectrum disorder, talk to your child's pediatrician, your child's psychologist, or set up an appointment at your local children's hospital.